Endometriosis is a condition that affects 1 in every 10 women in the United States, and it is where your endometrial cells grow on the outside of your uterus rather than the inside. My case study is over a woman who's 22 years old, and when she was 13, she got her first period, and about 6 months later, she realized that she probably needed to go see a doctor because something was really wrong. She was having extreme nausea, pelvic pain, cramping, just everything was kind of off. So by 14, they diagnosed her with endometriosis, and they started her on oral contraceptives. That's a very common way to try and treat it, but sometimes birth control is just not for everybody, which is what she said. So she stopped taking the oral contraceptives because she didn't like the way it made her feel. She felt like it was just making everything worse. So by 15, she had a laparoscopic surgery, which is where they go in and scrape the endometrial cells from wherever they've invaded, and hers invaded her bladder and her ovaries. So she said that helped her for about 3 to 4 years, but by the 4-year mark, her health started plummeting again. She started cramping all the time. She started getting very nauseous constantly, and she had a lot of pelvic pain, and she just didn't feel well all around. So she started going back to the doctor, and she decided that she was going to go on a new kind of hormone, and it's called Lupron. Well, in 6 months of taking that Lupron, she gained 50 pounds and felt absolutely not better at all. So she decided that she wasn't going to take the hormones anymore, and she was just going to deal with it. So her way of dealing with it was taking Loratabs every day to deal with the pain. She said it didn't get rid of the pain, but it definitely made it more tolerable. And she would just use a heating pad for her cramping, but that doesn't really get rid of the fact that she has endometriosis. So she looked into her options, and she wanted to get a hysterectomy, which means removing her uterus altogether. But since she's so young, she was 19 at the time, they told her that she was too young to perform that surgery and that they wouldn't do it. But she also only had a less than 1% chance of getting pregnant. So she really didn't understand the point of them not taking out her uterus, but she has to do what the doctors say. So she started this new treatment called reflexology. A therapist reached out to her, and they talked to her about the reflexology, and it is where you massage certain parts of your hands and your feet, and it connects to different parts in your body. So like the endocrine system, which helps control your uterus and reproductive system. So she decided she was going to try it. So the patient went once a week for 8 weeks for an hour each time. And they did it on her feet because they decided that that was going to be the most responsive way to do it rather than doing her hands. So they did 30 minutes on each foot, and they would massage certain parts of her foot. And from the observation of the therapist, they said that at the very beginning, like the first 2 to 3 weeks, she could only handle extremely light pressure because it would just send pain and shock throughout her whole body. She said it was deep and intense pain. So she didn't want to handle all that awful pain on her whole body, so he had to do it extremely lightly. But by week 3, they were doing moderate pressure with just very low pain. So she was getting a harder massage on her feet rather than just doing the light massage. But she was still dealing with a little pain, but not a lot. And then by week 5, she had absolutely no pain at all with the moderate pressure. So she had definitely made progress. And from the eyes of the patient, she said that she used to have diarrhea extremely bad throughout her periods, but now she only had it on the very first day of treatment, but none after that. And then she said that at the beginning of her treatment, her bowel movements would be very, very painful, and that she would just not look forward to doing that at all. But after the first the first 4 weeks, then she had no more pain throughout her the rest of the treatment with her bowel movements. And then her nausea at the beginning was extremely terrible. Like before her treatment, she would be nauseous all day long, but by her 4th week of doing the treatment, she was not nauseous at all. She said she would go days without feeling any of the symptoms of endometriosis, which was very rare for her, even whenever she was taking any of the hormones. And then she said that about the first 3 days before she had her cycles, that she would be a little nauseous, but not that much at all. And her headaches that she had, they used to be incredibly bad before she had any of the surgeries or before she was taking any of her hormones. That even if they didn't work, her headaches would still go away a little bit. But towards the end of her treatment, her headaches would only happen whenever she would have pelvic pains or cramping. So she didn't have headaches unless she was having other pains. But her pelvic pain and cramping were also only happening about 3 days before her period. So those kind of just came hand in hand, but she said that those were all tolerable. And the most successful result of the reflexology was that she could plan whenever her next cycle is coming. So before, when she was just taking the hormones or whenever she got her surgery, she still couldn't necessarily tell whenever her cycles were going to happen. But after the reflexology, she could tell. And then in her daily life, she started exercising because she wasn't feeling so lethargic all the time. So she lost some of the weight she gained on all the other hormones. And she just kind of felt all around better. So her endometriosis was getting fixed with reflexology. But that doesn't mean that all endometriosis can go away or subside with the pain. But it does mean that her case study was working, her reflexology was working for her.